Hi, Lindsay.
Hi.
How you doing today?
Doing well. How are you?
I'm good too. Before we get started today, I want to just go over your health history.
Perfect.
I saw that the medications that you take are albuterol and singular. What do you take those for?
I take them for asthma.
Okay, you take them for asthma. Okay. Thank you for letting me know. What triggers your symptoms with asthma?
High stress and like strong smells usually.
Okay. Well, thank you for letting me know that. When was your last attack? When was your last attack?
Just a couple months ago actually.
Okay. And then how was it treated?
I just used my inhaler.
Did you bring that today?
I did.
Great. Okay. I'll set that right here so it's within arm's reach.
Perfect.
Okay.
I don't think I can breathe.
You can't breathe? Okay. Please take 2 puffs of your albuterol, okay? I'll be right back. Code blue.
So what's going on?
My patient's having an asthma attack right now.
Okay, I will go get help.
Okay. Hi, Lindsay. I'll be right here with you. I want to make sure that you're feeling better. Did you take your 2 puffs?
Yeah.
Okay. Do you think that is helping?
Maybe a little bit.
Okay. I will stay here with you until faculty arrives. In just a second, I'm going to take your vitals, okay? I want to make sure your blood pressure is okay, and I want to listen to your respiration.
Okay.
Okay. So it's been about 10 minutes since your asthma attack. How are you feeling?
I think a little better. I can breathe now, which is great.
All right, good. We're just going to stop treatment for today. I want you to recover and see your physician, okay?
Okay.
Okay.
You just watched an asthma emergency in the dental setting. Asthma attacks are one of the more common emergencies in dental practices. During an asthma attack, the bronchioles constrict. At the same time, the inner lining of the airway spaces collect mucus, further reducing the patient's ability to exhale air. An asthma attack may be triggered by stress, an allergy to some dental material or anesthetic, or aerosols produced by dental instruments. During the health history interview, the clinician should observe and listen for respiration sounds, especially during the vital check before treatment. Also before treatment, any asthma attacks that have previously occurred due to an allergic reaction should be documented and flagged in Dentrix, including the allergen, the symptoms, duration, and treatment. Dental treatment should never proceed unless the patient has their inhaler at the appointment. The inhaler should be kept out and within easy reach throughout the entire appointment. During the appointment, there are several modifications a clinician may make to reduce potential emergencies. First, the clinician should ensure good pain control to avoid stress-induced attacks during and after dental procedures. The clinician may also choose to avoid procedures that create significant aerosols, such as choosing to hand scale rather than use the ultrasonic scaler. Finally, setting the patient in a semi-upright position may make breathing easier throughout the entire appointment. Despite these modifications, emergencies may still occur. If an asthma emergency occurs, the clinician should immediately stop the procedure, call code blue, set the patient upright, and instruct them to take 2 puffs of their inhaler. The doctor will determine if supplemental oxygen is also needed. Vitals should be monitored and recorded every 5 minutes. If the attack does not subside in 10 minutes, the doctor will likely order a second dose of the inhaler and activate 911 emergency services.
In the scenario today, the patient recovered in 10 minutes. In this case, the patient should be dismissed and advised to follow up with their physician. The clinician will record the situation in Dentrix, including the cause, the medications used, and the outcome of the emergency. To avoid the emergency today, the clinician might have kept the chair in a semi-upright position and asked the patient more follow-up questions during the health history interview to determine if other modifications could have been made before treatment and to determine how well controlled the patient's asthma was. Some other follow-up questions might have been, how often do you typically use your inhaler? Have you ever had a severe asthma attack that required hospitalization? Have you ever had an asthma attack in the dental office before?